COVID-19 impact on sustainable development. Agenda 2030 is about future and development, and certainly not about partisan politics. The resilience of society is particularly relevant during times of natural hazards, disasters, economic shocks, or pandemics. COVID-19 pandemic, in a very brief period, triggered a major crisis at the global level. No geographical area has been spared by the effect of the pandemic, causing a global economic recession, while more than a third of Earth's population was placed in lockdowns. All segments of the population were touched, in particular the most vulnerable persons. Older persons, migrants, and refugees were more likely to suffer consequences from the coronavirus crisis, having specific health and socio-economic conditions. School closures for almost 1.57 billion of students, limitation of access to healthcare, disruption in production and commercial chains were phenomena showing how serious this crisis affected the development agenda. United Nations report on SDG implementation in 2020 mentions that the pandemic will push 71 million people back into extreme poverty in 2020, in what would be the first rise of global poverty since 1998, while half of the global workforce supports themselves and their families through work in the informal economy. Even the most advanced and developed countries are experiencing huge economical problems, resulting in job losses. United Nations considers that the pandemic abruptly disrupted implementation towards many of the SDGs, and in some cases turned back decades of progress. The COVID-19 pandemic can be considered a test of resilience of our societies and shows how crucial is the effort for the achievement of the sustainable goals. In the light of 2020 developments, the fight against poverty or hunger is more relevant than ever. The same can be thought about healthcare, clean water and sanitation, or infrastructure. The achievement of Agenda 2030 cannot be done without secure jobs and economic growth. In an almost didactic manner, the pandemic has dramatically reaffirmed the relevance of sustainable development for all of us. From the perspective of SDG 5 related to gender equality, one of the pandemic implications is that women work fewer hours than men in the first quarter of 2020, according to Eurostat. Women assume additional household burdens during the pandemic, while they were already spending more hours on domestic and care work than men. Children were also at home in the context of school closures, and women had to provide them additional support and guidance. Unfortunately, lockdowns increased the violence against women and girls, and in some countries, domestic violence has increased by 30% according to United Nations data in 2020. In a world where gender equality remains unreached, women were on the front lines of fighting the coronavirus, women accounting for 70% of health and social workers. When looking in SDG 11, Sustainable Cities and Communities, the data showed that over 90% of COVID 19 cases are located in urban areas. Slum dwellers and those living in informal settlements were already suffering from bad living conditions, with limited or no access to water, sanitation, and waste management. More public transportation is needed in the world cities to reduce pollution and traffic. However, during the peak of the pandemic, public transportation was suspended, impacting productivity and inclusion. A lesson for the cities is to reduce the spread of coronavirus in public transportation systems and evaluate the extension of the public transport system to combat overcrowding.